Hello out there in television land. Welcome to yet another edition of It's Your Health. I'm with my son, the Fipster. We're going to be bringing you the latest and greatest in healthcare information. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. Welcome back to the first edition of It's Your Health, the fastest 30 minutes in television land. Right there, Fipster?
That's right.
We have a font of knowledge and information for you to digest out there, so go right ahead.
Just remember, before you try this stuff at home, make sure you review it with your healthcare practitioner.
Good point. Disclaimer.
That's from the legal department at News 13. Moving on. Headlines. Depression may sometimes foreshadow Parkinson's. Some recent studies have shown that sometimes some older men and women who have maybe early Parkinson's actually will not present with classic Parkinson's symptoms, but they may just simply be depressed.
Exactly, and I think that that's when we see a patient who has cognitive impairment, which means memory or personality changes. We'd like to make sure they don't have a reversible illness, and that is depression. Depression can sometimes present as difficulty with memory and what appears to be an Alzheimer's-like or Parkinsonian-like illness. So we'd want to try to reverse that by considering an antidepressant. But keep in mind that you might be depressed and have these issues when you're talking about structural brain chemistry and damage as well. So it's sometimes hard to tease that out, but it's worth looking into.
Yes. Moving forward. Crocodile. It's a new drug that unfortunately is inundating our streets. This is a rather dangerous synthetic heroin that's being imported from Russia. Have you heard anything about this?
I haven't heard anything about it per se. I'll lean on you for that. But you know, the whole drug issue around is just explosive, and it's very concerning. We have drugs among us, all around us, invading our youth, and it's something that we see almost on a weekly basis, particularly in the headlines. And maybe you can inform us a little bit about this issue?
Well, it's a synthetic heroin that's injected, and the reason it got its name is because of how it destroys the skin so quickly, and it actually turns the skin into a crocodile-like skin. It's very dangerous. It's going under that, quote, name, crocodile. That's oddly named. But certainly any illegal drug is dangerous, but this one sounds particularly so.
Right. I think Russia may have had some issues because they were low on heroin and they're trying to cut it and make it last longer or whatever. So bad news no matter what.
Moving forward. FDA approves a new antidepressant, medication called Brintellix, which is a rather new antidepressant. It works similarly to some of the other medications. It's a serotonin reuptake inhibitor, but it also has serotonin agonist effects, so it helps your body make serotonin.
That's a novel approach. Serotonin, of course, is part of our brain chemistry, keeps us on an even keel when the serotonin levels fall, particularly this time of the year in the fall, for example. We can get a seasonal affective disorder, but depressive symptoms are sometimes hard to recognize and diagnose, but they're fairly easy to treat. So if you are having depressive symptoms, just don't feel quite right, check with your healthcare provider. Help is on the way. Yeah,
certainly an interesting medication. I'll look forward to giving it a crack. Moving forward, let's start talking about something a little bit different. Diabetic foot infections. You know, these are big problems. They're not something that are simple to cure. They're not something that are simple to just fix. They sometimes can be hard to, as a patient, to identify because of some of the diabetes problems we have.
Well, diabetic foot infections are a big concern, as you say there, Phil. And they're a setup for it because they have decreased circulation and they have decreased sensation to the area. I recall one patient this summer who was walking on a hot deck, didn't realize it was hot, was barefoot, and had decreased sensation in the lower extremities, ended up with a burn, didn't know they had. And the diabetes, with cutting down on the circulation, lends itself to infections. And these infections are very quick to manifest themselves, but slow to go away, and they can sometimes invade into the lower structures and the bone, which of course is a big problem because the scenario involves a diabetic foot infection. You end up with infection of the soft tissues going to the bone. Then you're talking about surgery, amputations, and the like. Foot care is crucial, just as important as the eye care and the total global care that we need to pursue with our diabetic patients.
Yeah, certainly. It's you know, there's no small diabetic foot infection. They just don't clear up that quickly, and it's usually a sign of worse things to come if we really aren't getting our sugars under control. It's one of the things that we stress about proper diabetic care and getting these sugars under control when you're a diabetic in your 40s and 50s. So we're not in our 70s and 80s and, you know, hacking off parts. The way to prevent that is to get proper glycemic control early.
No doubt. And one other thing that we often forget is to keep in mind that if you have a foot infection, as with any open wound, make sure your tetanus immunization is up to date, because lockjaw is a preventable illness. However, once you get lockjaw, it's a little more difficult to treat.
That's an interesting segue into our next topic.
Really?
A little bit of a stretch, but let's talk about whooping cough and pertussis.
Oh, okay. That is, it was totally unplanned. Tell us about it now.
Well, as you may know, whooping cough is making a small resurgence in our area. Now, I certainly have not had the opportunity to see this in my career, but we're starting to see more and hear more and more cases of it. This is something that, at my age, I was vaccinated as a child for this, but it turns out that vaccine's starting to wear off in some individuals, and we're starting to see a resurgence, particularly a little bit more scary for infants who have not been vaccinated yet, and they have to get it from someone. It turns out there are some carriers to this, and there are people out there who have never been vaccinated now. And so maybe you've had a grandchild born recently, or you're having a child, and all of a sudden you're being told you have to go get a tetanus shot or get a whooping cough shot. And that's one of the ways we're hearing more and more about this.
Right.
And we're starting to vaccinate a lot more people for Tdap, which is tetanus, and pertussis, which is the whooping cough, prophylactically now.
Right, and our standard tetanus shots are now tetanus, diphtheria. And again, these things will wear off over a certain period of time, 10 years-ish. So in addition to getting vaccinations, which we talk about this time of year, influenza and pneumonia, you might want to just check and make sure you're up to date on your tetanus, diphtheria shot, and especially if you have youngsters in your house.
Yeah, it's make sure that's at what's called Tdap, tetanus, diphtheria, acellular pertussis.
All right, and on that note, we're going to finish up our first segment. I told you it was the fastest half hour in television land out there. We'll be right back. You're watching It's Your Health, your leader in healthcare information. Welcome back to the second segment of It's Your Health. Philip Benyo with Philip Benyo. We're plowing through the cornucopia of medical information that you have been accustomed to receiving.
That's right, very optimal.
There you go.
Moving forward. Let's talk headlines again. The shape and size of your wine glass may skew how much wine you actually think you're drinking.
I got to hear about this one.
Well, I'll give you an example.
Okay.
I have a various font of wine glasses at the house. Now, I have ones from grandfather age that are real small dinner glasses. They hold maybe 5 ounces of wine tops. And then I have the bowls. We're talking cereal bowls that can fit a bottle of wine. People ask, well, do I have a glass or two? Yeah, I have 2 glasses of wine at night. Now, are they filling the bowl or are they filling the 50-year-old glass? Which one is it?
That's a good point. That's a good point. So the size of the glass would actually determine how much you're drinking.
Yes, and that's a big part of it. I've had many people say, well, I only have 2 or 3 mixed drinks a night, but they're mixing them in pint glasses as opposed to a small shaker glass. And it's important to realize that a glass is just not a glass, that the recommended serving size for alcohol is actually given as ounces.
Right.
1.5 ounces of a spirit,
Sure.
5 ounces of wine, 12 ounces of beer,
Right.
Not a growler. So, it's important to look at that because often a lot of people are inadvertently over-consuming.
It reminds me, when we were in our training, we were taught that when we're taking a history of how much alcohol do you use, whatever they told you, you put that number and you squared it. And that was the real, the real alcohol use.
That's about right. I don't ask even how many glasses. I ask how long it takes for them to go through a case or a bottle or whatever it is.
That makes
You can
sense.
get it better. Moving forward, new cholesterol-lowering drugs show early promise.
Yeah, we, of course, are a little bit fixated on cholesterol, heart disease, stroke, and cardiovascular disease, number one killers in this country. And part of trying to prevent these illnesses is not only blood pressure, not smoking, keeping your sugar under control, but lowering the bad cholesterol and the cholesterol in general. And statins, of course, have come under fire to some degree. I kind of like statins a lot, and you're going to hear more about them as we go on today. But tell us a little bit more about this particular medicine.
This is a very new medication. It's a novel pathway. Instead of looking at cholesterol production, which is what statins do, they inhibit the production in the liver. This medication is actually going to remove it from your bloodstream. And other than that, I don't know much else about the mechanism of action. In a very small trial, it showed it was safe. They're now moving to much bigger trials.
Wow.
So it certainly will be exciting to hear about over the next couple of years.
Keep listening to It's Your Health.
That's right. We'll let you know. Speaking of statins, statins may not harm memory after all.
Well, again, for every reward there's a penalty, and some people who take statins just don't like the fact they're taking them. They may have muscle aches or pains. There was concern about memory issues, but it turns out that's not the case.
Yeah, and it's funny because a couple of years ago, prior to these memory issues, we actually had talked here that, statins may have some evidence to show they decrease the risk of dementia. Part of statins is we don't know how they work fully, and they do a lot of neat things, and we're going to talk about that later on as well. But one of the things is that, they've taken a real good look at this memory issue, and it's very rare cases. I think we'd be lucky to see a handful of people in our practice ever have a true memory issue from the medication just based on the numbers. But the benefits certainly in that instance far outweigh the risk.
Yeah, there's no doubt. I think statins are a terrific drug. Some of them will actually lower the inflammatory process, the C-reactive protein, if it's measured. I think there's some issues that can reduce cancers as well. So
yeah, there's a lot of neat things, and that's where the real push is, and that's what I guess we'll talk about now, is that statins do more than just lower your cholesterol. They help modulate our immune system, and they also help reduce inflammation. And those things carry into so many different things. And we used to think of statins once someone had a heart attack or once someone had a stroke. Well, let's get serious and get their cholesterol down. Now we use them much more in primary prevention. And someone may say, well, I don't have any problem. My cholesterol is a little high. The data, the trials, the Prove It trial, Jupiter trial, these things actually show that, for primary prevention, they're one of the best things we can do. You can lower risk 44% of primary stroke and heart attack by starting a statin.
right, no doubt. And if you recall, those who are avid watchers of It's Your Health, I brought in a headline from the British tabloids, if you will, that had big headlines saying anyone over 50 should be on a statin. Period, end of statement. And that's how strong they feel about it across the pond.
Yeah, and because of their social healthcare system, they're able to look at large volumes of people and see how small changes like that can change a population's health. We have a harder time doing that, but they can do that very easily. And again, talking about statins and some of the anti-inflammatory properties, this is a wild study, is that they showed that statin use helped decrease the risk of COPD exacerbation. Now, how are those two things linked?
Again, if you think of an inflammatory process, chronic obstructive lung disease, recurrent bronchitis, emphysema, here the use of statins had been shown to lower the risk of rehospitalizations of these illnesses. Again, it's one of those benefits that you are not necessarily thinking of getting, but you end up getting kind of as an extra package. So are we moving right along?
We're moving right along. Let's get away from the statins for a minute, but still talk about some, again, primary and secondary prevention things. And one of those things is osteoporosis and fractures.
Approximately 2 million of you out there are going to fracture something within a year's time. And if you total up all the diseases that we're concerned about, cancer, heart disease, stroke, heart attack, believe it or not, if you add all of those up, they do not come close to fractures in this country. So fractures overwhelmingly is a big healthcare concern. And unfortunately, in this particular vein, we're probably not being as proactive as we should be. Women should be getting their DEXA scans every 2 years, especially after the age of 60, 65. Men can get osteoporosis, and generally they're recommended to get those things after the age of 70, unless they're on other medications that can cause osteoporosis. But the big deal here is we can actually slow it down and prevent it. And it's with the use of some of the oral medications, the biophosphonates. However, those who don't want to take that pill every week can get rather safe injections, what, twice a year?
Yeah, I think the idea of the bisphosphonate, we've kind of gone away from that now. And because of some of the issues, some of the jaw issues, if you need dental work, you have to be off these medications for like a year. It can be a real pain to prescribe. And there's GI issues. They can cause ulcers and irritation, and so there's tolerability. Now we have a once every 6-month injection. The data behind it is much better. We really don't see a risk to this medication. It's much safer. I've never found anything that is more altering of someone's independence than a fall with a fracture. You break a hip and you're in your 70s or 80s, you have a vertebral fracture and you're in your 80s, your level of independence is coming down. You're not going to be home living alone anymore. You're going to be in some type of personal care home or a skilled nursing facility. And so preventing fractures is really important because it's what helps us maintain our level of independence.
Life-changing events. And speaking of life-changing, you're still watching It's Your Health, your healthcare provider and information network. We'll be right back after this brief commercial message. Welcome back to the third and final segment of It's Your Health. And you made a good point there, Phil, about life-changing events. If you take someone who has had a hip fracture, just to kind of finish that segment, one of three things happen. 1/3 of people with hip fractures will end up in a nursing home the rest of their life. 1/3 of patients with hip fractures will ultimately die within 6 months. 1/3 will go back to their independent living activity as life was before the fracture. So when you fracture a hip, 2 out of 3 things happen that are bad to you. So again, we want to be a little bit more proactive, identify the patients at risk, and put them on hopefully preventative medication so they don't end up going down that road.
Right. Let's get back to our headlines. Speaking of some of our older population, the aging brain tends to have more trouble with financial decisions. What do you think about that?
That's why I'm still working. Well, again, we're talking about cognitive issues and making decisions. And, in the olden days, I think we could rely on one's own self and the financial information and perhaps on experts. But in today's markets, you can't predict, that the sun's going to come up tomorrow. So that coupled with poor decision making can lead to financial ruin, particularly as these baby boomers are getting along in life and have to rely on a nest egg, which may not have as many eggs as they had planned on before.
This next headline is just about as surprising as the sun is hot.
Okay.
Colon cancer screening works. Well, there you go. Who would have thought? Now you know.
You heard it first. Again, colon cancer, probably the #1 cancer next to lung in our area, and it's certainly very screenable, and by that we mean by getting a colonoscopy. A colonoscopy will help to determine whether or not you have polyps or growth, which of course are pre-malignant conditions. And unfortunately, colon cancer is a silent disease. You may not necessarily bleed and have that luxury of saying, I had some bleeding in my stool and let's go for a colonoscopy. Then they often will grow silently to the point where they obstruct, which is a concern because you want to get at these polyps and growths sooner rather than later. It's something that's really difficult to explain why when we say to a patient, why don't you go for a colonoscopy, they kind of turn up their nose and say, no, I ain't going to go through that. It's a painless, relatively safe procedure that will perhaps save your life.
Yeah, colon cancer is not the type of thing you will know you have until it's spread. And that's the thing. I have a lot of people, I know if I have that. you'll know when it's moved somewhere else, and by then you're done. We don't have much of a treatment algorithm for that. Then we're just kind of trying hard. But it's something that's very easily preventable, very easily treatable if you find it in its infancy. That's the key.
Yep, I think that's an underutilized screening thing in particularly our area.
Moving forward, vitamin B supplements may guard against stroke.
Yeah, again, vitamin B, folic acid, C-reactive proteins, this is inflammatory issues. It certainly can hurt, and a lot of people are on these acid reducers, proton pump inhibitors, for example, Zantac, Prilosec, and they've been shown to reduce the absorption of the B vitamins particularly. So we're actually seeing more and more B12 deficiencies as a result of what we're doing to ourselves.
And the alcohol use, too, is another big one. Not that I give that twist. But those big glasses, they lower your B12, too. Let's move forward. Lowering triglycerides are something that will certainly help decrease your risk of some of the effects of diabetes.
Right. We talk, of course, about statins and lipid profiles and cholesterol, but triglycerides don't really get much of a play, Phil. Maybe you could enlighten us a little bit more about that.
Triglycerides are the transport molecule for your good and bad cholesterol. They're the bus that takes it around your arteries. If you have a higher triglyceride level, that means you have higher circulating fat running through your veins or arteries. It would stand the reason there's a better chance we're going to lay down plaque if we have a higher circulating concentration. Statins don't necessarily lower triglycerides. They may lower them like 10%, but if your triglyceride's 300 and we want it less than 150, 10% is not going to get you where you need to go. We use specific medications for that. Diabetics certainly have a higher risk of high triglycerides due to the insulin resistance pathway that is part of the reason triglycerides get high. Diabetics, it's not uncommon to see triglycerides sometimes in the 300s, 400s, 900s. You see some legendary values, and it's important to get them down because they can cause all kinds of problems. They can lead to pancreatitis and lead to heart disease.
And they're best measured fasting?
Yes. Triglycerides, if I went and had a cheeseburger an hour ago, my triglycerides are going to be higher because, again, they're the transport molecule for fat. So they fluctuate throughout the day. It's important to get that fasting.
Get it fasting. All right.
Let's talk about something a little bit different. Again, all-cause reducing risks of hospitalizations. Digoxin, foxglove plant,
yes,
reduces the risk of all-cause rehospital admissions in patients with CHF.
The more things change, the more they remain the same. 30 years ago when we were at Hershey, we used a lot of digoxin for heart failure. It kind of fell out of favor in place of using ACEs and ARBs and diuretic therapies and the like. But nevertheless, it's making a comeback. And one of the key factors that we want to watch out for is your readmission rate to the hospital. And heart failure is one of the diseases that will cause you to be readmitted within 30 days of a hospitalization. It turns out Lanoxin can reduce that risk and put you over that magic 30-day limit.
Yeah, there's specific subgroups it helps, and so it's important to see, it explains why you might be on a medication that usually is sometimes, its indications are usually somewhat unclear. We have people who have atrial fibrillation, they take it. We have people with CHF who take it. It does require blood work to monitor because it does have a therapeutic window, and if it gets too high, it can lower your heart rate too much and get you in real trouble. So it's something we have to be careful with.
Yeah, and don't forget drug interactions as well. Sometimes they can interfere with Lanoxin levels. And speaking of interactions, we thank you for allowing us to come into your home, entertain, inform, and interact with you. Remember, you're watching It's Your Health, your leader in healthcare information. Thanks for joining us.